Americans were reported to have spent over $10 billion on cosmetic procedures in 2010. Nowadays, women receiving breast implants and tummy tucks are more common than ever. However, imagine if that patient was a 16-year-old girl and both procedures was given as a sweet 16 present from her parents. Personally, I find it appalling that a parent would even consider letting their 16-year-old daughter have breast augmentation surgery. Cosmetic surgery is real surgery, and there are real risks involving as with any surgery. Therefore, parents should be banned for paying and consenting to unnecessary surgeries on teens. Cosmetic surgery is defined as a medical surgery that maintains, restores, or enhances normal appearance beyond the average level towards some visual ideal. Teens undergoing cosmetic surgery is a rising trend. Why? Because of magazines with airbrushed supermodels and television shows add pressure to look perfect in an increasing competitive world obsessed with beauty. Reality shows such as MTV's I Want a Famous Face misrepresents cosmetic surgery as a quick fix with no consequences. Cosmetic procedures could last anywhere from 1.5 hours up to 7 hours, not including the post-operation care. It could take several weeks to recover from pain and bruises, and the risks involving in undergoing a cosmetic procedure includes blood clots, infections, scars, permanent numbness, paralysis, and even death. Can you picture parent or surgeon subjecting a minor to this type of torture for vanity motives? Bullying is another reason why some teens are turning to cosmetic surgery. Many teens are uncomfortable with their appearance. Going through puberty is an awkward time. Teens feel like they have to fit in with their peers to have a normal life. But does this seem like a reasonable excuse to permanently alter your body? Dr. Costano, a reconstructive surgeon, states that if they aren't old enough to sign their own surgeon consent for a medical necessary procedure, then they shouldn't be able to induce their parents to do it for cosmetic surgery. What happened to buying more fashionable clothes or getting a stylish hairdo? Both are less expensive and risky than going under the knife. Also, an important concern is that teens' bodies are still growing. A chubby teenager could grow in height and become a slim adult. A nose that might seem large at 14 may be the right size later in life. Or a female might not develop breasts until she reaches her late teen years. When cosmetic surgery is used to correct it, the teen may perhaps end up looking worse than before. And there is always the possibility that the surgery may not go as planned, and what appeared as an imperfect trait can become a deformity. Teens should put off elective surgery until they are physically and emotionally mature. A longitudinal study of abstinence, age 11 to 18, found that body images satisfaction improves among teenagers as they mature. According to the American Society of Anesthetic Plastic Surgery, there were 4,153 breast augmentation performed on teen girls ages 18 and younger in 2010. Nearly 50% of the surgeries included breast implants. Although the FDA only approves a saline breast implant for women older than 18 and a silicone gel implant for women that are 22 and older. Furthermore, breast augmentation surgery has a very high complication rate. Even with no complication, breast implants rarely last more than 10 years. For a teen girl of 16, that means she will probably need corrective surgery when she is 26, 36, 46, and every decade of her life after that. In fact, breast implants will make it difficult for her to breastfeed her own children. There's something wrong with parents who are encouraging and obsessing over appearance in their children. And teens should not be allowed the option to have cosmetic surgery with or without a parent consent. If you feel the same way, please email or write a letter to your state legislator on implementing a cosmetic surgery ban that will protect the well being of minors.